Welcome to the Quick Start Guide for Medline's Automatic Digital Blood Pressure Monitor, model MDS1001. This unit ships with one adult blood pressure cuff that fits arm circumferences ranging from 22 to 30 centimeters. It includes an instruction manual, a quick start guide, and 4 AA alkaline batteries. If you have ordered MDS1001U or MDS1001UT, it will come with a universal-sized cuff for an arm circumference of 22 to 42 centimeters. All of the functions for MDS1001U and MDS1001UT are the same as MDS1001. On the front of the unit are systolic and diastolic measurements, along with the memory and start-stop buttons. On the left-hand side, you can see the air tube socket where the cuff connects to the monitor. On the back is the compartment for 4 AA alkaline batteries. Within the battery compartment, you will find the serial and lot number of your blood pressure monitor. Before using your device, make sure the batteries are installed correctly. The positive and negative ends of the batteries must be inserted according to the polarity diagram found on the inside of the battery compartment. Let's begin by setting the date and time. Make sure the device is powered off. Then hold down the memory button for about 5 seconds or until the digits on the screen begin to flash. Press the memory button repeatedly until the desired year is displayed. Once the year has been set, press the Start-Stop button to assign the correct date. Change the month value with the memory button, then press the Start-Stop button to toggle to the day value. After setting the day with the memory button, press the Start-Stop button once again to assign the time. Please note that the time on the unit can only be displayed in military time, hours 0 to 24. There is no AM/PM time setting. Continue to set the hour in minutes using the same 2 buttons. After selecting minutes, press Start-Stop a final time and the screen will turn off. The date and time are now set. If you have the MDS1001UT Universal Talking model, you can set the device to announce your results in English or Spanish. Press the Start-Stop button after setting the minute to enter the talking feature selection. Then press the memory button repeatedly to toggle between 01 English, 02 Spanish, and off. Press the Start-Stop button once you have set the talking feature to save the settings and exit. Now let's look at cuff placement. The cuff should be snug but comfortable. It should be about 1 inch above the break of the elbow joint, and the artery mark should be in line with the patient's brachial artery. The tube should go straight down the arm in line with the middle finger. The triangle arrow on the outer edge of the cuff should be in range with this line. It's very important to make sure the cuff is sized properly. Otherwise, you can get an inaccurate measurement. Here, we can see that the triangle arrow falls within the proper range. When you're about to take a blood pressure measurement, please make sure the individual is seated. His or her arm should be placed palm up on a flat surface with feet flat on the floor. Make sure the cuff is level with the heart. If you are taking the blood pressure measurement lying down, please place the arm along the side, palm down, cuff level with the heart. Please note that blood pressure can be affected by many factors, including genetics, age, sex, altitude, physical activity, stress, muscular development, certain medications, eating, drinking alcohol or caffeine, smoking, and even the time of day. Here are some helpful tips for taking accurate and consistent blood pressure readings. Sit quietly for 5 to 10 minutes before taking a measurement. Apply the cuff snugly, allowing room for no more than 2 fingers between your arm and the cuff. Please remain still and refrain from talking during the measurement. Wait 5 to 10 minutes between readings to allow blood flow in the arm to return to normal. Now let's use this unit to take a blood pressure measurement. The cuff is plugged in on the left-hand side and the power button is pressed to begin the measurement. The cuff inflates until it gets to above what it expects the systolic pressure to be. Then it starts decreasing. When the measurement is complete, you will see the systolic at the top, diastolic at the bottom, and pulse rate on the left. Remember, you can stop the inflation or deflation of the cuff at any time by pressing the Start/Stop button. This unit can store up to 90 past readings. When more than 90 readings are stored, the oldest ones will automatically be replaced. By pressing the memory button, you can see the average of all recorded readings here in the lower left-hand corner. When you press the memory button again, 01 will appear in the lower left-hand corner, which means you are looking at your most recent reading in the memory. Keep pressing the memory button to cycle through the older readings. Thank you for taking the time to watch this instructional video. You should now understand how to use your blood pressure monitor. If you are still experiencing difficulties, please contact the Medline Customer Service Center at 1-800-MEDLINE with any questions.